Question 1. A nurse is preparing to administer an antibiotic, but the patient reports a history of rash with this drug. What is the nurse's best action? A. Administer with an antihistamine. B. Document the allergy and continue. C. Notify the provider immediately. D. Ask the patient to describe the rash. Answer: C. Notify the provider immediately. Question 2. Which action demonstrates safe handling of high-alert medications? A. Delegating administration to an unlicensed assistant. B. Administering without verification if the provider ordered it. C. Performing independent double checks before administration. D. Giving the dose early if the patient reports symptoms. Answer: C. Performing independent double checks before administration. Question 3. A patient questions a new medication you are about to give. What is your best initial response? A. Tell them the doctor prescribed it. B. Recheck the medication order. C. Encourage them to take it. D. Administer it quickly to avoid delay. Answer: B. Recheck the medication order. Question 4. The nurse is preparing a subcutaneous injection. Which action supports patient safety? A. Aspirate before injecting. B. Use a 1.5-inch needle. C. Rotate injection sites. D. Inject at a 90-degree angle regardless of patient size. Answer: C. Rotate injection sites. Question 5. Which task is inappropriate to delegate to an unlicensed assistive personnel UAP? A. Reminding a patient to take oral meds. B. Reporting a patient's pain level after medication. C. Observing for side effects of medication. D. Measuring fluid intake after diuretic therapy. Answer: C. Observing for side effects of medication. Question 6. What is the most critical action when administering medications to a patient with dysphagia? A. Use thickened liquids with pills. B. Crush all pills together for convenience. C. Assess swallowing ability before each dose. D. Offer large sips of water after pills. Answer: C. Assess swallowing ability before each dose. Question 7. A nurse is unsure of a medication's purpose. What is the appropriate next step? A. Administer it as ordered. B. Ask another nurse for clarification. C. Consult a drug reference or pharmacist. D. Document it as a routine dose. Answer: C. Consult a drug reference or pharmacist. Question 8. A medication label says refrigerate after opening, but the bottle has been stored at room temperature. What is the nurse's action? A. Continue using the medication. B. Label it correctly and refrigerate. C. Notify the pharmacy and discard the medication. D. Shake the bottle and administer. Answer: C. Notify the pharmacy and discard the medication. Question 9. A patient receiving for morphine becomes increasingly drowsy. What is the nurse's priority action? A. Increase for fluids. B. Stop the infusion and assess the patient. C. Notify dietary. D. Prepare the next scheduled dose. Answer: B. Stop the infusion and assess the patient. Question 10. A nurse prepares a dose of insulin and realizes they have drawn up regular insulin instead of NPH. What is the best action? A. Administer the dose since both are insulin. B. Ask another nurse to verify and give it. C. Discard and prepare the correct insulin. D. Call the provider to change the order. Answer: C. Discard and prepare the correct insulin. Question 11. A nurse receives a medication order with unclear handwriting. What is the best action? A. Guess based on previous orders. B. Ask another nurse what it says. C. Contact the provider for clarification. D. Hold the medication until the next shift. Answer: C. Contact the provider for clarification. Question 12. A patient states, "That pill looks different from what I usually take." What should the nurse do? A. Recheck the prescription and verify the medication. B. Reassure the patient and administer the drug. C. Explain that medications come in different brands. D. Ask the provider to change the pill. Answer: A. Recheck the prescription and verify the medication. Question 13. What is the nurse's most appropriate response to a patient refusing a medication? A. Document the refusal and discard the medication. B. Ask why the patient is refusing and notify the provider. C. Leave the medication at the bedside. D. Return the medication to the cart. Answer: B. Ask why the patient is refusing and notify the provider. Question 14. A nurse is teaching a patient about a new medication. What instruction ensures safety at home? A. Take your pills in the dark to avoid light sensitivity. B. Keep your medications in the kitchen for convenience. C. Use a pill organizer and follow the instructions exactly. D. Ask your neighbor if you forget how to take it. Answer: C. Use a pill organizer and follow the instructions exactly. Question 15. Which of the following is most important when administering medication to a pediatric patient? A. Let the child decide when to take the dose. B. Use weight-based dosage calculations. C. Administer based on age only. D. Crush all medications and mix in milk. Answer: B. Use weight-based dosage calculations. Question 16. When should the nurse use hand hygiene during medication administration? A. After documenting the medication. B. Before preparing medications and before patient contact. C. After scanning the medication barcode. D. Only if touching the patient. Answer: B. Before preparing medications and before patient contact. Question 17. Which situation best illustrates adherence to the right documentation principle of medication administration? A. Documenting before administration to save time. B. Documenting the dose after patient discharge. C. Documenting the time, route, and response immediately after administration. D. Asking another nurse to document while administering. Answer: C. Documenting the time, route, and response immediately after administration. Question 18. Which of the following nursing actions helps reduce the risk of medication error when giving PRN medications? A. Give the PRN dose with the scheduled dose. B. Clarify the indication and timing before administering. C. Skip documentation for PRN drugs. D. Ask the patient if they feel better after the last dose. Answer: B. Clarify the indication and timing before administering. Question 19. A nurse is preparing to administer an oral medication, but the patient is NPO for surgery. What is the correct action? A. Administer the medication anyway. B. Crush the medication and give rectally. C. Hold the medication and notify the provider. D. Wait until after surgery. Answer: C. Hold the medication and notify the provider. Question 20. A nurse sees a colleague preparing medications without checking the march. What should the nurse do? A. Ignore it if the patient knows their routine. B. Report the colleague to the nurse manager immediately. C. Remind the colleague to verify with the March. D. Take over the colleague's medication pass. Answer: C. Remind the colleague to verify with the MAR. Question 21. A nurse is administering digoxin and notes the patient's apical pulse is 56 BPM. What is the appropriate action? A. Administer the drug and monitor. B. Hold the dose and notify the provider. C. Give half the dose. D. Document and recheck in 2 hours. Answer: B. Hold the dose and notify the provider. Question 22. A patient is receiving a potassium-wasting diuretic. Which medication order should the nurse question? A. Potassium chloride supplement. B. Furosemide 40 milligrams for. C. Spironolactone 25 milligrams orally. D. No potassium supplement ordered. Answer: D. No potassium supplement ordered. Question 23. A nurse notices that a colleague consistently prepares meds for multiple patients at once. What is the best response? A. Join in to save time. B. Report the colleague to the supervisor. C. Educate them about medication safety risks. D. Avoid addressing the issue. Answer: C. Educate them about medication safety risks. Question 24. A confused patient is refusing to take medication. What is the most appropriate nursing action? A. Restrain the patient and administer. B. Educate the patient about the purpose. C. Hide the medication in food without informing them. D. Skip the dose and document refusal. Answer: B. Educate the patient about the purpose. Question 25. Which of the following would require immediate notification of the provider after administering a new medication? A. Mild nausea. B. Itching and shortness of breath. C. Slight drowsiness. D. Dry mouth. Answer: B. Itching and shortness of breath. Question 26. What is the correct nursing action after discovering a medication error? A. Ignore if the patient is stable. B. Document and notify the provider immediately. C. Ask a colleague to fix the chart. D. Wait for symptoms to appear. Answer: B. Document and notify the provider immediately. Question 27. A nurse receives a telephone order for a high-alert medication. What should be done to ensure safety? A. Accept the order without verification. B. Repeat back the order for confirmation. C. Wait until the provider is available in person. D. Have another nurse take the order. Answer: B. Repeat back the order for confirmation. Question 28. Which action by a nurse prevents look-alike/sound-alike medication errors? A. Store them together alphabetically. B. Use tall man lettering when labeling. C. Ignore labels if the package is familiar. D. Memorize by color and shape. Answer: B. Use tall man lettering when labeling. Question 29. What is the nurse's priority when administering a vesicant medication through 4? A. Administer rapidly to prevent vein damage. B. Use the smallest vein available. C. Monitor for signs of infiltration or extravasation. D. Use the same site for multiple vesicants. Answer: C. Monitor for signs of infiltration or extravasation. Question 30. A nurse is teaching a patient about warfarin therapy. Which statement indicates a need for further teaching? A. I will eat green leafy vegetables regularly. B. I will have my INR monitored routinely. C. I can take aspirin for headaches. D. I will report signs of bleeding. Answer: C. I can take aspirin for headaches. Question 31. Before administering a new oral antihypertensive, what is the nurse's priority assessment? A. Respiratory rate. B. Pulse oximetry. C. Blood pressure. D. Bowel sounds. Answer: C. Blood pressure. Question 32. A nurse is preparing to administer a transdermal patch. What is an essential step? A. Place over the previous patch. B. Apply without gloves. C. Date and initial the patch before applying. D. Cut the patch to adjust dose. Answer: C. Date and initial the patch before applying. Question 33. UAP reports a patient is dizzy after antihypertensive administration. What should the nurse do first? A. Tell the UAP to monitor closely. B. Assess the patient immediately. C. Increase fluid intake. D. Report to the provider without assessing. Answer. B. Assess the patient immediately. Question 34. What is the correct nursing action before administering chemotherapy? A. Perform handoff to another nurse. B. Double-check the medication with another licensed nurse. C. Ask the patient to self-administer. D. Mix the drug at the bedside. Answer. B. Double-check the medication with another licensed nurse. Question 35. A patient is ordered a medication via a route the nurse is unfamiliar with. What should the nurse do? A. Refuse to give the medication. B. Consult the pharmacist or reliable reference. C. Ask the patient how they've taken it before. D. Substitute with a different route. Answer. B. Consult the pharmacist or reliable reference. Question 36. A patient is prescribed a time-sensitive medication every 4 hours. What demonstrates correct timing? A. Administer at patient's request. B. Administer within 30 minutes before or after scheduled time. C. Administer all doses together at end of shift. D. Administer only when symptoms appear. Answer. B. Administer within 30 minutes before or after scheduled time. Question 37. What is the safest method for patient identification before medication administration? A. Ask the patient's room number. B. Check the patient's chart. C. Use 2 unique identifiers like name and DOB. D. Rely on visual recognition. Answer. C. Use 2 unique identifiers like name and DOB. Question 38. A nurse prepares medication for a patient who is not in the room. What is the best action? A. Leave it at the bedside for later. B. Keep the med and return when patient is present. C. Give it to a family member. D. Return it to the med cart and document as given. Answer. B. Keep the med and return when patient is present. Question 39. A patient on antibiotics develops watery diarrhea and fever. What is the nurse's priority action? A. Encourage fluid intake. B. Assess for signs of Clostridioides difficile infection. C. Give antidiarrheal medication. D. Stop the antibiotics immediately. Answer. B. Assess for signs of Clostridioides difficile infection. Question 40. Which medication requires use of a filter needle for safe administration? A. Morphine sulfate. B. Diazepam. C. Ampicillin. D. Glass ampoule medications. Answer. D. Glass ampoule medications. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.